Hi everyone, welcome back to my YouTube channel. Today we are going to talk about significance of deep cervical fascia. We will start our topic with introduction. The deep cervical fascia play essential role in structural support, compartmentalization and clinical application within the neck. It forms an intricate network of connective tissue that enclose, protect and organize various anatomical structures including muscles, nerves, blood vessels and vital organs. This fascia also determines the spread of infection and fluid movement, making it an essential factor in medical diagnosis and surgical interventions. Now let's talk about structural and functional importance of deep cervical fascia. The first is stability and support. As the deep cervical fascia provides mechanical stability to the neck by reinforcing the arrangement of muscles, vessels, and neurovascular structures. It also ensures the proper positioning of thyroid gland, trachea, esophagus, and major blood vessels, preventing unnecessary movement or compression. This facial layer acts as a protective sheet surrounding the carotid arteries, jugular veins, and vagus nerve, shielding them from external forces or trauma. Further talking about structural and functional importance of the cervical fascia, it also helps in compartmentalization. It has the deep cervical fascia divides the neck into compartments, ensuring structural integrity and preventing friction between anatomical components. These compartments include the musculoskeletal compartment, visceral compartment, and neurovascular compartment, each playing a significant role in specific physiological functions such as swallowing, respiration, and circulation. By separating tissue into distinct regions, the fascia optimizes movements, coordination, and vascular efficiency. Now let's talk about role in infection control and spread. The first is restriction of pathological spread. As the facial layer acts as a physical barrier, helps to localize the infection and prevent their rapid spread within the neck. Conditions like abscesses, hematomas, or tumors are often contained within the specific facial compartment, minimizing their impact on neighboring tissues. The investing layer of deep cervical fascia prevents infection from rapidly infiltrating deeper structures. Second is it helps pathways for disease progression, as certain facial spaces allow the movement of fluid and infection influencing disease progression. The retropharyngeal space permits infection to travel from throat to the mediastinum, potentially leading to severe medicinitis. The dentate space that extends from the base of skull to the diaphragm possess a major risk of infection spread to the thoracic cavity. Understanding these infection pathways helps clinicians predict disease spread and implement timely intervention. Further talking about surgical and clinical importance, it also provides guidance and surgical procedures as the deep cervical fascia is crucial in neck surgeries where anatomical landmarks must be precisely identified. Thyroidectomy, neck dissection, and carotid artery surgeries rely on facial compartment for safe access to the vital structures. Surgeons navigate facial planes to minimize bleeding and avoid accidental damage to major blood vessels or nerves. The second surgical and clinical importance is trauma and vascular injury implications. As trauma affecting the deep cervical fascia may lead to hematomas, nerve damage, or vascular compromise, and injuries to the carotid sheath can result in life-threatening hemorrhages or neurological deficits to the vagus nerve involvement. Rapid intervention is required to manage penetrating neck wounds and blunt force injuries affecting facial compartments. Now let's talk about the contribution to neck mobility and function of deep cervical fascia. The first is by facilitating muscle movement. The fascia reduces friction between muscles, ensuring smooth neck movements and flexibility. It supports head rotation, flexion, and postural control, contributing to overall musculoskeletal coordination. Second, it helps in contribution to neck mobility and function by enhancing respiration and swallowing function, as the pretracheal layer ensures unimpeded function of the trachea and esophagus, allowing efficient breathing and food passage. By providing structural reinforcement, the fascia prevents collapsing or compression of vital neck structures, maintaining airway patencies. The third way it contributes to neck mobility and function is by supporting neurovascular structures, as carotid sheath containing the common carotid artery, internal jugular vein, and vagus nerve is formed by the deep cervical fascia, ensuring protection and efficient circulation. This prevertebral fascia houses brachial plexus in the control upper limb movement and sensory function. Now let's talk about clinical and pathological implications of deep cervical fascia. is by spread of deep neck infection. As the facial layer determines the spread of abscess, cellulitis, or tumor in cervical region, deep neck infection can extend into chest or cranial region, requiring immediate medical attention to prevent complication. Second is by tumor localization and management. Tumor confined within the facial compartment may be easier to surgically remove, reducing the risk of metastasis. And understanding facial pathway helps in radiological imaging, biopsy procedures, and tumor staging. Now let's talk about the conclusion. Deeper cervical fascia is crucial in anatomical structure influencing neck stability, compartmentalization, surgical accessibility, and pathological spread. Its complex engagement dictates movement efficiency, protection of neurovascular structures, and clinical management of infections and tumor. And understanding its significance enhances diagnosis, treatment, and surgical precision in managing cervical condition. And this was all about deep cervical fascia significance. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.